Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. And today we'll be discussing Polymyalgia Rheumatica, or PMR, which affects approximately 450,000 people in the United States. We're joined today by some very special guests. Most notably amongst them is a patient with PMR, Eileen Salsman. We also have Angela Degrassi, my colleague from GHLF. She's our Senior Manager, Patient-Centered Research Operations and Engagement here at the Global Healthy Living Foundation. And then we have two distinguished doctors with us today. We have Dr. Jeff Curtis from the University of Alabama at Birmingham and Dr. Len Calabrese from the Cleveland Clinic in Cleveland, Ohio. So let's get into it and let's discuss some PMR. So I want to thank our guests for joining us today. We have with us our patient representative, Eileen Salsman.
Hello.
Hello. My colleague from GHLF, Angela Degrassi.
Hi, happy to be here.
And two experts in the field, Dr. Len Calabrese from the Cleveland Clinic and Dr. Jeff Curtis from the University of Alabama at Birmingham.
Hey, it's our pleasure.
Thank you.
Angela, thank you for joining us here today on The Health Advocates. Great to see a familiar face, a colleague. Can you just give us an overview of the PMR project that you and a number of people here at GHLF have been working on and what it aims to achieve?
Sure, Stephen. So this is a CDC-funded project, and it aims to map out what is known about PMR, identify gaps in knowledge, and create educational materials for public health professionals, clinicians, and patients. So over the past 2 years, we've taken time to really examine research studies and healthcare data and public health insights to piece together a comprehensive understanding of this disease. And the goal is to use this big picture to guide both education and support for everyone affected by PMR.
Excellent. Angela, you've been working together with a panel of experts around PMR. What has this panel been working on exactly?
Sure, this has been such a fascinating part of the project because we get to engage with so many people with different perspectives. So our PMR panel of experts includes a wide range of voices, including rheumatologists, geriatricians, primary care providers, health insurance and policy experts, industry representatives, and of course, patients. We brought this group together to prioritize knowledge gaps that we identified during our data gathering phase. Essentially, we shared what we learned and created a list of gaps, and now we're using a modified Delphi method to systematically rank their importance. So that's where everyone's different perspective comes in. So this hasn't been a research-intensive process. We've been using the Delphi to identify topics and see what really needs attention from a multi-stakeholder perspective. It's a work in progress, and we're really looking forward to sharing the results soon.
Great. And what does this work mean for people who live with PMR and the doctors who treat them?
Good question. By understanding what's missing and what's important to the healthcare community, including patients, we can help researchers prioritize study questions and to fill those gaps. For our organization at GHLF, these insights will guide where we focus our educational efforts, ensuring that both patients and clinicians get the information and resources they need the most. We know this is a disease that affects many people, and more research is needed to understand the various elements of this condition and how it affects people in their day-to-day lives, and really what clinicians and researchers need to really impact care and outcomes for patients.
And for Eileen, can you introduce yourself and tell us a little about your journey in getting diagnosed?
My name is Eileen, and up until the point I had PMR, I had a wildly fun and successful career designing science, technology, engineering labs and working with school districts all over the country. When I got PMR, it happened immediately, and within a couple months I had to quit because I was too sick. So there's a good start to who I am. Oh, I'm a grandmother. I love my grandkids. I have 3 grandkids, one son who's married to a wonderful woman, and I have a very large Irish family that loves me and supports me and gets in my way.
Okay. And what kind of resources would you like to see made available for people who are newly diagnosed?
I was thinking a lot about that, and I'll just tell you a couple of the things that really would have helped me. When I first got diagnosed with PMR, I went into the doctor. She said, oh my gosh, this is PMR. Get you on steroids right away. Get an appointment with a rheumatologist right away. But then I had no idea what to expect from that. It was a process, that I was going to have highs and lows. I had a horrible flare-up and didn't know what that was about. So anything that helps understand the process, and then through Facebook and other things, I was able to form like a support group. And so I got some answers that way.
What advice would you give other patients about speaking up when they feel something is wrong?
I think that the key thing about speaking up is to really understand a little bit about PMR, because otherwise you don't know what to speak up from. So for instance, I had no idea how sneaky PMR was. Is that one day your hips hurt and the next day your shoulders hurt and the next day your ankles hurt and the next day you had a headache. And when you're explaining that to friends or to your doctor, it sounds like you're either a hypochondriac, a crazy person, or you're beating yourself up. But that's just the way PMR is. It can be evidenced all over the place. So I think that that's a really big point I would have liked to know. And then the second thing is that PMR supersizes everything. And I think that people would really love to have known that. For instance, my grandkids were over, one had the sniffles, I got pneumonia. I stepped out of my car and I turned my ankle a certain way and I stretched and tore some ligaments in it. And I'm just like, what has happened to my body? This isn't how it used to be. And knowing ahead of time that just about anything that happened to me, PMR was going to make it worse. And having those kind of caution habits in place ahead of time and understanding that would have helped me so much.
If you could change one thing about how PMR is diagnosed or treated, what would that be?
I think having an advocate, like I had breast cancer before this, and I had a patient advocate, and that was just the most helpful thing in the world, is I could call her and say, am I insane? This is what's going on with me. Having a patient advocate would have helped so much, because you don't know when you have PMR. Like, I didn't know when I hurt my ankle that was PMR, and I couldn't understand why it took 4.5 weeks to get better. So having somebody to talk through those kinds of things with, I think would be hugely helpful.
Well, Eileen, perhaps you could be a patient advocate for others.
I'm part of a Facebook group, and I did the posting with Montel Williams, and I really didn't want to do it, Steven, because I've gained 40 pounds. I can't control sometimes how much I sweat. So I'm not the same person that professionally had presented herself all her life. So I was mortified to be on TV and to have people see me. But I got over 250 responses back from people from England and New Zealand and Australia and all over the world when I posted that video on my Facebook PMR page. And people were saying things like, I gave this to my son and he finally understands I'm not crazy. Or I finally understand I'm not crazy. Or now I understand I can look flare up and manage it ahead of time instead of getting blindsided by it. So I have done that, and it was completely a surprise to me. So I got to say, there's kind of like no ego involved in this. I just want to continue. If there's anybody out there that I can help by just being a voice, I'll do it.
Yeah, no, absolutely. I think you hit on something that's so critical for people dealing with all kinds of diseases, but PMR in some respects is in its own special category. Just the idea of knowing what it's like to have the disease, the normalizing what it is that you're going through, and just knowing that there are others out there that are dealing with it as well.
Yeah, for an example, this is just the norm for me now. I used to be a yes person. I said that before, and now I'm a no person, because what happens is on my birthday, I had planned to take my daughter-in-law, her mom, and her sister, and we were all going to go to a spa for the day. I arrived at my daughter-in-law's house, and I said, I can't walk today. I'm not going. I can't do anything. And it's my birthday, and I was all sad and kind. Well, I sent them up to the spa. My son set me up on the couch and made me a birthday cake, and I got to hang out with the grandkids. And that's what PMR's like. At first, people were always mad at me because I was canceling all the time, and now they just get it.
Yeah, and it's good to educate those around you, and I would hesitate, I don't want to be too aggressive, but say, I don't think that you're a no person, you're just, we have to perhaps change things and make things different, but I'm still there, I'm still a yes person.
Thank you for that. That's a big part of it too, is finding out who I still am. This disease has impacted so much of me, but where's that core? Where's that core of joy and hope and what feeds me even when I can't get off the couch? And that's been the biggest piece, that if there's something I could do for other people, it would be that. Find your core and still find a way to still be yourself.
Well, thank you, Eileen, for sharing your story, not just with us here today, but to the world in so many different forums. It really helps others, as you've indicated. And now we're going to be joined by two experts who are well known in their field. And we at GHLF have had the opportunity of working with these fine folks. The first is Dr. Leonard Calabrese from the Cleveland Clinic, and the second is Dr. Jeff Curtis from the University of Alabama at Birmingham. Welcome to both of you. So, Dr. Curtis, What do you see as the biggest unmet needs in PMR care that would benefit from stronger advocacy efforts at the policy or regulatory level?
I'm happy to tackle that. So, historically, steroids have been the mainstay of therapy, and for many patients, the only therapy. So, I know trying to get my patients access to some of the newer drugs, particularly the interleukin 6 receptor antagonists, this isn't an easy thing always. One challenge is just patients and referring doctors knowing that there is an option that isn't some of the prednisone and things like it, treatments out there, that there's something new. That's one aspect. I don't see a lot of television ads for PMR treatments. Of course, there really aren't many advanced new therapies that have been approved. There's certainly some that are in development, and I'm glad about that. But this is not a disease that has quite the same visibility as some of our other rheumatic diseases where we've got 10 or 12 or more treatments. There's very few out there. So I think access to both the specialists who are comfortable prescribing interleukin 6 drugs and hopefully new biologics or targeted treatments in the future, as well as insurance coverage for those treatments so patients can access them and not break the bank. I think those are some important unmet needs to get patients their care that they need.
Dr. Calabrese, how can healthcare providers help amplify the patient voice in shaping research priorities and healthcare policies related to PMR?
This is a complicated question for any disease, but I think that polymyalgia rheumatica, considering that it is the second most common immune-mediated inflammatory disease, is really traveling under the radar screen. As Jeff has noted, we don't see any type of disease awareness ads on television about this. It is not something that is commonly discussed. And I think for what is going on in our society, where there is now a push for living longer but living healthier, the specter of polymyalgia rheumatica needs to have a higher profile, because this can occur at any time in a person without previous comorbidities and really can take a large piece out of quality of life. So I would like to see it highlighted more on the disease awareness scene.
And maybe this last question is for you, Dr. Curtis. Are there specific barriers, whether in recruitment, education, or healthcare access, that you believe advocacy groups should focus on to improve PMR outcomes?
So I think there's a couple answers that come to mind for this question. So healthcare access for any rheumatologic condition is always an issue because there simply aren't enough rheumatologists. And advanced practice providers can fill really important roles. And I think that that has been very helpful to our field just because we have a massive workforce shortage. That said, PMR, as Len already alluded to, is one of those conditions that is often managed by primary care docs. And that's often where the diagnosis is made. There's not a huge number of diseases that might start in primary care and be solely managed in that setting, and then sometimes but not always move to a fully specialty managed setting or co-managed care. Gout is another of those that comes to mind. But I think access to care and having some defined guidelines, ideally coming out of some of the internal medicine or family practice settings, when is it right to refer, and having some of those joint guidelines, as perhaps the American College of Rheumatology has done at times with other specialty societies, that help set up what should the expectation be for the role of primary care docs or other specialists, and then the role of rheumatologists, so that we can help better care coordinate, get patients the treatment they need. And if that ends up being on fancier biologic therapies in the hands of people comfortable prescribing them, then to kind of rein in some of the inappropriate variability where patients don't have access to that care in those specialties.
Yeah, Eileen, before turning back to you, Angela, is there anything that you want to add to some of these topics?
I was diagnosed by my GP, and she got it right away. And she said, just like Doctor had said, I had no pre-existing, one day I couldn't move. And so that was really good. As far as the other drugs or the other medicines, my rheumatologist has been really good. But just on a personal basis, I have great insurance coverage. I'm on Medicare and I have a supplement. And it still was over $2,000 a month for some of those because they were not covered. I mean, I actually had to say, I just don't see the benefit of this one for its cost, and we had to get me off of it. And then the second was that the PMR doctor, my rheumatologist, had to work really hard with the insurance companies to advocate for me to get on a different medicine. But steroids have just been horrible for me. I mean, they're a blessing and a curse, if you can see, but I get these red splotches all over my body if I bump into anything. When I'm in the sun, I have to wear complete sun guard and for everywhere. And talk about quality of life. Steroids made my hair thinner. weaker, my bones weaker. As far as the emotions, I've just learned to control them. But there have been times I've been sitting at a family dinner and I just burst into tears over something. And I'm like, please ignore me. This is not Eileen. This is a steroid. We're going to go fix it. But it's like always, always, always there. So it's not just that there's only one treatment. It's that the treatment is really, really hard on you.
And Angela, I hear you have an upcoming webinar for patients and clinicians about PMR. Can you tell us what that's about and why people should tune in?
Sure, I'd love to. So we have a webinar coming up on September 18th at 6:30 p.m. Eastern. You can watch it live on YouTube. We'll drop the link to register in the episode description so you can look for it there. And it's not every day we get to speak with rheumatologists who are experts on PMR and who really know the landscape of the entire healthcare system. So if you're in public health or treat people with PMR, or you have PMR yourself, we'll be discussing the importance of disease surveillance, including monitoring disease activity at the patient level and tracking this condition across the population. Shilpa Venkatachalam from GHLF will be the moderator, and our special guests will be familiar voices, Dr. Jeff Curtis and Dr. Len Calabrese, who are both rheumatologists. Please remember, sign up and join us on YouTube on September 18th, and make sure you log into YouTube so that you can interact with us live.
Great. Well, I want to thank our guests, Eileen, of course, our patient advocate. I'm going to call you that from now on, Eileen. Angela, Dr. Curtis, and Dr. Calabrese. Thank you so much. And we look forward to learning more about PMR and how we can help patients and be better advocates for these patients.
Thanks, Steven.
Well, thanks for joining us today here on The Health Advocates. It was a great conversation with experts on PMR, an expert patient with PMR, and of course, a GHLF colleague who works in the patient community. I think my biggest takeaway is the need for more advocacy at the direct local level. You've got to be your own advocate, and once you are an advocate, you've got to be an advocate for others. This is a difficult condition to live with, but it can be less difficult with more help and more advocates like Eileen. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.